All right, so this is skill 2.32, administering medication by nebulizer. Okay, so there are two ways to do a nebulizer. Okay, one is by a machine. It's a small little machine. It's usually portable. Looks just like this. You plug in. It runs really loud, and you put the oxygen tubing here, and it pushes air into the nebulizer so that you get the mist, which is what the patient's going to breathe in, okay? The second is, oh, here's the tubing. So you put the tubing on the machine like this, okay? And then this would go on to the actual medication administration set like this, and the patient would breathe that in, okay? All right. So that's with a portable nebulizer machine. In the facilities, in the hospitals, what they'll do is they will take this oxygen tubing and they will connect it to the air source in the hospital. This is called a Christmas tree, by the way. See this? Looks just like a Christmas tree, right? So if anybody ever tells you, go get a Christmas tree, you'll know what it means, okay? This goes on the oxygen or the air outlets that are on the walls at the facilities, okay? You screw it on, screw it right on, and then the oxygen tubing or whatever would be connected to that, okay? So it's going to look like that, okay? So facilities would use the wall-mounted air mechanisms, and again would be connected to the bottom of the nebulizer, okay? All right, so first thing you're going to do with any medication administration is you're going to check your medication order. You're going to make sure that you have a medication that is a nebulizer that is due for your patient at this time, okay? You're going to go to the med room or wherever it is that it's held, and the medication is held, and you're going to get that medication. When you are taking it out of the med drawer or the location, you're going to look at the medication. You're going to say, yep, I have the right med, and yep, it's okay to use because it's not expired, okay? All right, so then you're going to check the medication label 3 times for safety. Once when it was taken from the drawer, yep, that's what it is. You're going to compare it to the MAR and make sure, yep, I have the correct medication, the correct route, the correct time, the correct dose, okay? And then you're going to also check it again against the MAR when you get into the patient's room, okay? All right. You're going to prepare the correct amount of medication without contaminating it. Most of your nebulizers are going to come in, in single dose vials, ampules, whatever you want to call these. Okay, so you're just going to get, usually it's just one of them, and I believe that this one is albuterol sulfate inhalation solution, and it's 2.5 milligrams per 3 milliliters. So this is a 2.5 milligram dose, okay? That it's pretty standard, okay? All right. So then you're going to go into your patient's room and you're going to perform WIPSA. Now you're dealing with a patient's mouth, oral secretions. You may want to put some gloves on, okay? All right, so we performed WIPSA. We're going to place the medication in the nebulizer chamber, okay? So first of all, this is what the nebulizer is going to look like, and there's going to be a white mouthpiece here, okay? I don't have that. Hold on, I'm going to go see if I can find one. Hold on just a moment, okay? All right, I'm back. I found the mouthpiece, okay? So this is what your nebulizer unit is going to look like, okay? The steam is going to escape from here, okay? It's open. See, it's open. This is the mouthpiece where the patient's going to put their mouth around to breathe that in, okay? Sometimes you'll hear them talk about, okay, smoke your pipe, because it looks like a pipe, right? Okay. So what happens is this is the medication chamber here, okay? In order to get the medication in there, you could do it one of 2 ways, okay? Well, this whole top will come right off of there, and you can instill the medication through there. But the best way to do it is to unscrew the bottom part of the chamber, bottom part of the med chamber, okay, and instill the medication into here. And how do you do that? Well, this is the medication dose, right? And what you're going to do is you're just going to twist that cap right off of there. Twist right off, okay? And then you're going to instill the medication into this chamber. Now, you don't want to instill it into the middle here, okay? You want to make sure it goes onto the sides, okay? So you're going to push that medication into there. You're going to get it all in there, okay? All right, so see all the liquid in there? You see that? Okay. Then you're going to screw the top of the chamber back on, okay? Screw it back on. There we go. So now we have the nebulizer ready to go, okay? Now, you're going to make sure that your air source is ready to go. So for this, I'm going to use the machine. It's going to be loud, so I'm going to try to move the machine away from away from the camera as much as possible so that I can minimize the noise. I don't know how good that's going to do, but we're going to try it, okay? All right. Because I want you to see the steam that's going to come out of here. All right. So we've got the one end of the oxygen tubing to the air supply, the compressed air supply. That could be on the wall, it could be through the nebulizer machine, okay? We're going to take the other end of the O2 tubing, and we're going to put it on the bottom, whoops, the bottom of this. There's an air, you'll see it, okay? You push that tubing right onto that, okay? All right, make sure it's nice and on there, nice and snug, okay? So this is what it looks like. You got it? Okay. So then what you want to do is you want to tell the patient to to hold the mouthpiece in their mouth and close their lips around it, okay? Now if your patient's not able to hold this in their mouth for an extended period of time, you can take a mask, okay? And you can put the treatment onto the mask, okay? And it slides right on to the mask just like that, and then you can put it on your patient and they can breathe it in that way. So if they're unable to hold the nebulizer pipe in their mouth for the amount of time, usually takes about I'd say about 2.5 minutes to get the full dose, okay? Maybe longer, it depends on how much medication, okay? All right, so they're gonna hold it in their mouth and you're gonna turn on the machine or the air on the wall. And what's gonna happen is air is gonna aerolize the fluid that's in here, okay? And it's gonna come up and they're gonna breathe it in. Now some of it is gonna come out the end, yes, okay? Some air, some mist is going to come out, but generally they're going to breathe in most of the medication, okay? Now I'm going to turn this on and hopefully you'll be able to see the mist, okay? I'm not going to leave the machine on for long because it's quite loud, but I want you to see the mist in it, okay? So hold on. Can you see that mist coming out of there? Okay? You see that mist? That's what they're going to be breathing in, okay? And look in the chamber. You see how that the air is moving that medication around and it's aerolizing it, okay? So they're going to be able to inhale it, okay? You're going to keep them doing that. Hold on. You're going to keep them breathing this in and out, okay? To keep them from talking, first of all, because they want to talk when they're doing it. Don't do that. You want them to just breathe regularly. You want it nice and deep, get it in there, okay? You want to do that until there's no more liquid in here, okay? You're going to take all that medication in, okay? You're going to have them deep breathe and hold for several seconds and then exhale slowly every 3 to 5 breaths. Okay, so make sure that they're just getting it in there. Is this going to make them cough? You betcha. Okay, a breathing treatment normally will make them cough, and that's good because we want to open that up. We want to get those secretions out of there. Okay, all right. So then you're going to turn the airflow off, and you're going to adjust or put back in nasal cannula, or if they're needing oxygen, you're going to make sure that you have the correct flow of oxygen, okay? If not, you're just going to clean up your supplies, okay? You're going to clean the mouthpiece, okay? Clean this mouthpiece. And then make sure that you rinse out the medication chamber, rinse it out, throw out the medication, you know, little drops that are in there, throw them out, rinse it out, okay? And then you're going to store this in the bag. Usually there's a respiratory bag beside the bed or in the drawer beside the bed. And that's where you're going to keep all of their respiratory supplies, okay? You're going to dispose of and replace any components according to agency policy. So know what your agency policies are, okay? You're going to remove your gloves at this point. You're going to make sure that the patient's comfortable and do all your closing down things that you would do for a patient, okay? You're going to remove your gloves if I didn't already say that. You're going to perform hand hygiene, and then you're going to document anything that you just did, especially in the MAR, because you just gave a medication, okay? Now, before you do nebulizer treatments, what's important, do you think, to assess before and after you give a nebulizer treatment? You're right. You want to listen to lung sounds. You want to make sure that the medication's doing what it's supposed to be doing, okay? You may hear some adventitious lung sounds prior to giving the medication. And then after they've taken the medication, because what's it going to do is going to make them cough, okay, you should hear clearer lung sounds, okay? So that will tell you that the medication's actually working, okay? So that is skill 2.32, administering medication by a nebulizer.